dancing here in the studio this morning, but we do want to talk about a GMA health alert, a first of its kind major new study that found mothers raising children with heart defects are more likely to have heart problems themselves. Chief medical correspondent Dr. Jennifer Ashton is here with more. Jen, this is huge news for women and heart disease, which so often goes undetected and untreated.
Potentially massive news for women's health because we're talking about the #1 killer of women, heart disease, and we're talking about the #1 most common congenital birth defect, which is a heart defect. This was a massive study done in Quebec, Canada, looked at over 1 million women who had just given birth to babies with congenital heart defects, both critical and non-critical or less severe, followed them for 25 years to find out, is there an association for the moms? We know about the babies, and they actually found that the moms who have had babies with heart defects were 25% more likely to be hospitalized for cardiovascular events. And we are talking anything from stroke, heart attack, to needing a heart transplant. And what was interesting is the more critical or severe the defect in the baby, the sooner that cardiac event manifested in the moms.
What do you know about what is putting them more at risk?
That's the question. We really don't understand. I mean, the theories out there, could there be a genetic predisposition that first showed up in the baby and then manifests later in the mom? We don't know. Interesting is a stress pathway. We know that raising a child with any type of birth defect, especially a congenital heart defect, triggers a whole stress cascade. And then there are common risk factors, diabetes, obesity, that can increase the risk of a birth defect in a baby and then future heart disease in the mom.
And how can they reduce these risks?
This is really the interesting thing here. There is a massive push now in the specialties of OBGYN and cardiology to recognize the common ground, screen women if they require screening, and to make the awareness not only in the mom but also in the healthcare provider. If you have had a pregnancy-related complication like preeclampsia, gestational diabetes, or problems with the placenta, that in fact is considered almost a failed stress test later on in life. So we need to talk to each other, and women need to be aware.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.